got her snacks.
Hi, I'm going to give my speech today on how to prevent infection. Germs are something we encounter on a daily basis, whether we like it or not, or whether how clean or dirty we are. Infection is also something we encounter, whether it's laying dormant in somebody or you can see it manifest through the signs and symptoms. What I'm going to be talking to you about today is how to prevent an infection. There are multiple ways, whether that is washing your hands, using your personal protective equipment, getting vaccinations. The list goes on and on, but the three I'm going to focus on today are washing your hands, getting vaccinations, and using standard precautions and personal protective equipment in the hospital setting. First off, washing your hands is something you should do. It's almost as a second nature, whether it's after eating, before eating, after playing with an animal, after playing outside in general, after using the bathroom, or any other time you feel necessary, and also in the hospital setting in between patients. Washing your hands is a very vital task to do in the healthcare setting, and that is one thing that is preached to you in nursing school from day one. As stated in my Potter and Perry book, my Nursing Fundamentals Potter and Perry book, it says step by step how to wash your hands. So you want to start just lathering them all up. You want to make sure that you get your fingernails. That's something a lot of people don't think of. You want to make sure you get your fingernails. And one thing that I learned is even your wrists, because dirt can accumulate there, and a lot of people just think if you wash your palms and your backs of your hands, you're good to go. Well, it's more in depth than that. And Potter and Perry also states 20 to 30 seconds of effective hand washing should eliminate as much bacteria as possible. Washing your hands, again, is something very easy, something that's second nature, and that is one very simple, non-invasive way to prevent infection. Another one that is more controversial for some is the use of vaccinations. For me, from what I've learned in nursing school, vaccinations play a vital role also in preventing infection. As stated in my pediatrics book, it says that there are numerous infections that can be prevented by the use of vaccinations. While yes, they are a little painful and sometimes uncomfortable, sometimes your arm's a little achy, but the long-term effects of those vaccinations greatly outweighs the few seconds of pain that you feel. Some that are standard are, say, your chickenpox vaccine, your rubella, MMR, and different things like that. They're just standard, your hepatitis vaccine, things like that you get as a child that help you throughout the years stay from getting those diseases. And as stating for myself, I have had all of those vaccines and never once had any of those infections. Another thing that can be used to prevent infection in a hospital setting would be the use of standard precautions and personal protective equipment. Your personal protective equipment includes gloves, and depending on the type of isolation your patient's in or whether they're in isolation, there are gloves, gowns, masks, face shields, and you can even wear footies in there for certain things. I've seen that before. So some patients are on airborne precautions where whatever infection they have is spread through the air. There's a droplet, which is spread from like spit or coughing or somehow their secretions getting on you. There's contact from, say, an open sore that may have some kind of disease that you can contact through touching their blood or whatever there is. But again, having your up-to-date vaccinations like this, having your up-to-date vaccinations, using your personal protective equipment, and washing your hands can play a vital role in not contacting those diseases. So some infections, or some signs and symptoms of having an infection may be fever, chills, lethargy, fatigue, just achiness, certain things that you're kind of used to seeing, which again goes back to the infection is something you see every day and it's a very common thing, so I'm sure those signs and symptoms you've seen before. Treatments for infection vary from antipyretics to treat your fever,